I also want to ask about bone-on-bone arthritis. You claim that AMR can actually relieve people of this pain from something called bone-on-bone. Talk about arthritis a little bit.
Again, these are models that we, again, have been stuck on because of chronic pain. What do you do when nothing works? What people don't realize is that people have very severely degenerated joints, but guess what? They're not in pain. But if you have an arthritic joint and you complain of pain there, they're going to blame the arthritis, because what else could it be? When I was younger, I had this woman that had, normally your spine from front and back is nice and straight. Her spine, front and back, was literally like this S. And it was so completely degenerated, I didn't know how she could be alive and walking around. And at that time, this was before I came upon this work, and there you go. She was a sweet patient. I tried every technique on the book at her, and it helped some, but didn't fix her. And with a spine like that, what do you expect? And years later, when I came across this work, I called her back up, said I was very impressed with this work, might help, and there you go. We applied this technique, only this time we got rid of all the numbness and tingling out of her arm. She felt so good, she stopped taking medication for chronic low back pain. So when you remove pain from severely degenerated joints, you can bet her bones were still arthritic, but the pain was gone. So what else can you conclude except it was the muscles crimping the joint? Same with hips. They say they want to call it bone-on-bone arthritis. I had a guy that they take an x-ray. The other hip was more arthritic. It was his less arthritic hip that's bothering him. Shot of cortisone was miraculous. But sometime later, he aggravated it again, only this time cortisone didn't do the trick. Now what do they want to do? They want to do hip replacement for bone-on-bone arthritis. The other hip was more arthritic. But again, when cortisone doesn't work, when physical therapy doesn't work, what else could it be? And again, so I told him, so these people, if you just give this work a chance, and there's nothing magic about it, it's just a lot of hard work. But yes, I'm seeing a guy right now who's told he needed hip replacement for bone-on-bone arthritis. They don't know any better. The truth is, when you look at an x-ray, you cannot tell whether or where someone is in pain. There's a couple of exceptions, but in general this is true. And you could look at the most perfectly normal, healthy spine on x-ray, that person could be in acute dire pain. Conversely, you could look at the most severely degenerated arthritic joint, but guess what? There's no complaint of pain there. If you see an arthritic joint but there's no complaint of pain there, we say it's asymptomatic or not causing symptoms. But if you are in pain there, what are we going to do? We're going to blame the arthritis. We're going to blame whatever we see there. Why? Because what else could it be? It doesn't feel like a muscle. It feels deep in the joint. It feels like arthritis feels deep. It doesn't feel like a muscle. There's no apparent spasm. And overpressing massage doesn't work on those degenerated muscles. It doesn't work. So,
what are some of the exceptions? You mentioned there are some exceptions when you look at an x-ray. What are some
well,
of
if you have a fractured bone, obviously you can tell someone's going to be in pain there. If someone has fluid in their lungs, if someone has a cancerous tumor. When it comes to back pain, all you have to do is rule out cancer, infection, fracture, some other exotic disease. Once you are in the realm of musculoskeletal, what is currently diagnosed as a disc, arthritis, stenosis, spondylolisthesis, bone spur, etc., once you're in the realm of musculoskeletal, I have absolute confidence. And it's all working backward. It's all working. There was a time I could not fix tough cases, and all of my knowledge comes from experience. Seeing conditions change I once did not think possible. And it's all, based on Thomas Reiner's work. It's his influence that set me straight. Mm-hmm. Now my AMR is entirely my take on what I gleaned from Reiner, his protégés, and my own observation. And if you compare our writings, it's apples and oranges. You wouldn't know we're talking about the same thing. I like simplified explanation, metaphor, and I like to make things simple. He tends toward the complex. Mm-hmm. But it's his influence that set me straight, and and it's allowed me to fix these tough cases. And I've been doing it for 25 years, and yeah, I feel a duty now. I know what this represents, and I feel a duty now to pass on what I've learned.
What would you say to people with chronic pain who's tried everything else and are considering going to surgery? How do you convince them to even give it a shot? Is this something that it's a very rare technique. Not many people do it.
Yes. Well, getting people to give you a try, I mean, that's up to them. But you know, people that have been in chronic pain, that have been let down by everything else, those are my people. Those are my people. And those are my favorite people. And when those people come in, the first thing they notice, no one's ever touched them like this. They have never been worked on in this manner, and it just feels right. It just feels right. But you're right. You know, that's the thing. The clients that I fix, they go out there, and as everyone knows, when you're in pain, you're inundated by experts and gurus and opinions. Everybody's got an opinion. Everybody has to go to. Everything works sometimes. And my people, they say, you should see my guy, but everyone's flooded with opinions. And so many times, I mean, I'm the last guy on their list or whatever, but all I need is a chance. Yeah.
So you just want to tell them, give it a chance.
Yeah, look, you know, yes, believe me,
it's not a hard sell.
I have been through the gamut of treatment. You know, when I graduated from school, I worked for a guy that could sell ice cubes to Eskimos, and he sold every patient that needed this for this enormous series of treatments. Back when I was more like a traditional chiropractor, and the invaluable part of the experience is that we were allowed to use a wide variety of techniques. So I got to observe and experiment with a wide variety of techniques, and I formed many opinions. And again, there's always it's all about those tough chronic cases when nothing works. And so if you're one of those people, I understand your frustration. I understand when you've been around and tried a number of things, you get frustrated. And you think you've tried it all. And so many things, when it comes to muscle therapy, so many things, they sound the same, it sounds similar. Many things sound similar in words, but how they treat the actual muscle is not. So many therapies have the same intention, to relax your muscles, to recondition them, but there's a big difference between a steam roller and a leaf rake, between ice cubes and stroking the muscles like one-time deck of cards. And again, so yeah, my favorite people are those that have been every place else first, because you can appreciate what we do. If you don't have that, if you haven't been every place else first, you can't appreciate this fully. Those people, they've been and that's the first thing they notice. No one's ever worked on them like this, and it just feels right.
So it sounds like you don't even have to you're not even trying hard to sell it, this work.
No, it speaks for itself.
It speaks for itself.
It just speaks for itself. Like I had a guy he had one disc surgery, he's in chronic pain for 10 years, and he had tried everything under the sun. And someone got him to see me. And all they need is to try it once. And when they try it, that's it. He could tell no one ever worked on him like this. It feels different, it feels right. And
talk about how, as far as toxicity release and what other benefits can you actually get with this method?
Well,
in comparison,
you know, by releasing these underlying patterns, we unleash a powerful healing effect throughout the body that is truly amazing. And it's just something you have to feel. We remove stored stress from the body, we improve circulation, and if you want to talk about moving chi, I don't think nothing moves chi like this. And this declumping effect, it's just something you have to feel.